rising concern over JN1 COVID variant. 358 new cases have been reported in the last 24 hours. This is a decline from Wednesday's tally of 614 cases. However, Kerala continues to remain a hotspot. Out of the 358 cases, 300 of these have been reported from Kerala. Within the last 24 hours, 6 deaths have been reported, which includes 3 deaths in Kerala, 2 in Karnataka, while 1 case is from Punjab. 21 cases of JN1 variant have been reported so far. 19 have been reported from Goa alone. Amid mounting concerns, authorities across India are stepping up vigil. Ghaziabad has advised social distancing and use of face masks. Meanwhile, Chandigarh has also advised mask usage in public places. In Karnataka, mask mandate is back for the elderly and testing has been ramped up. Karnataka Chief Minister Siddaramaiah will chair a meeting on the overall COVID situation in the state today. Masks for the elderly have also been mandated. Masks are also being advised in Kerala and Maharashtra. All right, we have Neha who's joining us from Bangalore as well as Jayalakshmi who's joining us from Kerala. Jayalakshmi, to you first. We believe the maximum number of cases at this point is from Kerala. Take us through the total tally at this point and what kind of steps have been taken so far by the state government to ensure there is some sort of control of this spread.
Yes, there have been 300 cases of COVID cases that has been reported in the last 24 hours in the state of Kerala alone. This is the highest number of cases that have been reported from the state compared to all other states. And
Kerala is the worst.
3 deaths have been reported in the 24 hours. So right now the state is under high precaution, and the Health Minister Veena George, she had convened the last emergency meeting, COVID meeting on last Tuesday, and they have said that all the necessary arrangements have been made even in the hospitals as of, even if there are rises in cases, they have separate wards for COVID, and they have separate ICUs that have been kept for COVID-related cases. And in fact, the state government is also monitoring the situation on ground, and she has assured that there is nothing to panic as such because everything is under control. But that's what the health ministry is giving us from the state. But we also know that the cases are rising continuously in the state. So for that, the health ministry in Kerala has asked everybody to take all the precautions and to use masks. Mandatory masking is also said by the state government.
So no reason to panic is what the state government in Kerala is saying. Let me also go across to Neha. Neha, what is the situation in Karnataka at this point? What's the tally like? We believe mask mandate is back for elderly, and there is going to be a high-level meeting that will be chaired by Chief Minister as well.
Well, Radhika, that's right. Ever since we saw the number of cases being reported from Kerala, the neighbouring state of Karnataka too, of course, has been asked to gear up for, a possible, rise in number of cases of COVID in Karnataka as well. Having said that, we've seen the health minister also yesterday having directed, all hospitals to get ready for, COVID cases possibly trickling in, and bringing you this report right now from the Bowring Hospital in Bengaluru, where you can see that, in fact, this is a COVID isolation ward that's been set up, wherein, the hospital, of course, is currently going to be taking in cases of COVID. You can see that the beds have been set up. In fact, all of the machines right now, the oxygen, beds also, of course, is what is currently being checked right now. Remember that, in fact, these are wards that have to be well ventilated. That has always been, a mandate here. And, of course, it's mostly back to the basics for most of these hospitals since they've dealt with COVID at the peak of peak. Now, of course, given the fact that hospitals have been asked to get ready, we're seeing that wards, isolation wards have to be set up, oxygen beds have to, of course, be set up, oxygen plants need to be tested, rapid antigen kits need to be acquired, the RT-PCR tests also. Quickly taking this across right now over here, in fact, to the doctor, sir, I want to ask you, we're seeing that it's back to the basics for all the hospitals. You all have dealt with COVID at the peak of the peak. What basic instructions have been given to all hospitals right now?
So, I'm Dr. Kempraj, Medical Superintendent of Boring Lady Curzon Hospitals, under Sri Atal Bihari Vajpayee Medical College and Research Institute. So, right now we got some instructions from the task force and government of Karnataka. As per the directions, we have kept our hospital ready for the forthcoming COVID situation. So now, as of now, we don't receive not even a single patient. And we have made arrangements to accommodate at now 50 beds in our hospital. If the number of COVID cases increases, we are ready to make up to more than 100 patients in the IP block.
Okay.
So right now we have made arrangements for the 50 patients.
Okay, sir, I want to ask you about the COVID kits that need to be acquired, whether it's the test kits or it's the other equipment, the PPEs and all of that. How is that going, sir? Has a request already been put out, or has the government, asked you to procure these kits? What is the procedure like?
Yeah, regarding the RT-PCR tests, so the government has given to do RT-PCR tests for the SARI patients and ILI patients. Since yesterday we are doing RT-PCR tests, we have conducted RT-PCR tests about 10 cases. So all the 10 cases become negative so far. So we are using the RT-PCR kits and rapid antigen kits which we have received in the previous first and second wave. So we have already exhausted the stock. Within 1 or 2 days, government will provide RT-PCR kits and rapid antigen kits. Even then, whatever the kits available in our institute, we are doing rapid antigen tests and also RT-PCR tests in our hospitals.
Great, sir. Thank you. So, there you have it, of course. This comes at a time when the health minister also has said that, about 5,000 tests in a day is what is going to be conducted across the state.
Right, Neha, thank you for bringing a sense of hospital and health preparedness in the city of Bengaluru. There, all measures, of course, being put in place amid growing COVID cases. Let's get to more breaking updates. A tragic accident from Amroha